Then also we provide MCQ that are from beginner level to expert level, which contain standard multiple choice questions. Then also you can book a slot for personalized counseling session in which there will be direct interaction of the student with the counselor. And Oracle, we have some subscription plans starting from basic to premium. So basic plan is of 3 months, standard plan is of 6 months, and premium plan is of 12 months. That cost around 50,000, and the services are included like pre-recorded classes, live doubt clarification, one-to-one personalized guidance, notes, quick revision, examination module. Then these are the classes that going to be conducted on various days. So now before proceeding, we have a clinical case scenario that we're going to discuss in the end of the session. So that is a case of a patient who is present to the emergency department with complaint of generalized weakness, fatigue, and swelling in his neck for the past month. He has a medical history significant for hypertension and also diabetes, type 2 diabetes, which have been poorly controlled. On examination, the patient appears lethargic and has pitting edema in his lower extremities. Laboratory investigation revealed the condition of hypoalbuminemia with a serum albumin level of 2.8 gram per deciliter. Further workup is initiated to determine the cause of its hypoalbuminemia. What is the mechanism by which hypoalbuminemia contributes to the patient's symptom of edema? So they are asking that what will be the reason of this condition of edema. So option we are having decrease oncotic pressure leading to extra fluid extravasation into tissue. B is increased hydrostatic pressure in the capillary causing fluid retention. Then C, reduced lymphatic drainage leading to fluid accumulation. Then D, increased capillary permeability allowing fluid to leak into tissue. So I hope after this session, all the students will be able to answer. So again, we're going to discuss in the end of the class. So today's objective, we're going to discuss about the function of plasma protein, importance, and also the clinical condition we're going to discuss that are associated with elevated or decrease in plasma proteins. So we have all these content in today's class. So coming to the introduction part, so we know that the plasma protein are of great significance, importance, since they perform several vital functions such as maintain viscosity, blood pressure, then provides immunity to the body, buffer pH, help in transport of various substances, and some of them also help in coagulation of that. So increase or decrease in any of these plasma protein disturb hemostasis and are also associated with the development of various disease and also help in the diagnosing various clinical conditions. So whenever these plasma protein get increase in the body or decrease in the body, so directly they are indicating the presence of the pathological condition, right? So talking about the various type of plasma protein which are present, so we have albumin, globulin, prothrombin, and fibrinogen. So about more than 300 plasma protein are present, but talking about the major concentration, so these are the proteins which are present in the major concentration. Once again, I'm going to repeat that first we should know that the normal level of the plasma protein is, it is 6.4 to 8.3 gram per deciliter. This is the normal level. Now coming to the classification. So we have albumin, we have globulin, then fibrinogen, and prothrombin. And the albumin one is the plasma protein which is present in the major concentration, and it is approximately 55%, right? Then globulin is approx 38% and fibrinogen is 7% and this prothrombin around 2%. Okay, so these are the major type of the plasma protein. Okay, now talking about the site that where these plasma protein are synthesized. So always remember that plasma proteins are synthesized in liver. Okay, they are synthesized in liver. Now talking about the types. So first we're going to discuss about the type of globulin. So we have alpha globulin, we have beta globulin, and we have gamma globulin. Now, alpha globulin is around 13% of the total concentration of globulin. It is 14% and it is 11%, right? Then also we have some other forms of globulin in which first we have glycoprotein. So as the name suggests, glyco means this is carbohydrate plus protein, right? Then next we have lipoprotein. So again, as the name suggests, it is also lipid plus protein. And also it has various subtypes. So its subtype includes HDL, LDL, VLDL, chylomicrons. These are the various subtype of lipoproteins, right? Then another form, we have transferrin. Okay. So here right now we are discussing about the various form of globulin, right? So we have transferrin. Now that this transferrin is basically a type of alpha to beta globulin. Okay. And why this transferrin is very important? Because it regulates and control iron absorption from GIT. That is why it is very important. Okay. And also it protect against iron intoxication. Iron intoxication. So it is useful in iron transportation. So these are the various functions that is performed by this transferrin. Then next we have, in next form, we have haptoglobulin. Again, this is a type of alpha-2 globulin. And it is very important because it prevents the loss of iron through urinary system, right? So as we know that iron is very, very important for our body, right? Because it does very important function, and the most important is the synthesis of hemoglobin. And as we know, the hemoglobin is very important for carrying the oxygen, right? So these proteins are responsible for the conservation of for the conservation of iron, right? Now, next function of haptoglobulin we have that it protect kidney from damage by hemoglobin. Okay. Now, next we have another type that is ceruloplasmin. And it is a type of alpha-2 beta globulin. It has a very important function that it binds with copper and help in its transport and storage. Okay, so this is the main function of this ceruloplasmin. Then next function, next form we have pituin. It is present in fetus and also in newborns. It is present in fetus and in newborns, and basically it is a growth promoting protein present inside the newborns, right? It help in the development. Okay, then last we have the very important, that is immunoglobulin. So it is the type of gamma globulin, and it is also known as antibodies. And as the name suggests, it is important for the defense mechanism inside the body. So this is all about the forms of globulin, right? Now, next we have the function of plasma protein, a very important function, that plasma protein why plasma protein are very important. Okay, so as the name suggests, various plasma protein we have discussed. That first was albumin, then we have globulin, then prothrombin, and fibrinogen. So one by one, we're going to discuss the function of all these plasma protein. Okay, so first we have coagulation of blood. Okay, so the plasma protein is very much useful in the coagulation of blood due to the presence of several plasma protein like prothrombin and fibrinogen, and also other coagulation factors are also there which are protein in nature. So all they are helping in the coagulation of blood. For example, that this pathway, the last pathway, as we know, the extrinsic and intrinsic pathway of blood coagulation. So there in the end, fibrinogen get converted into fibrin. So that's why the plasma protein are very useful in the process of coagulation of blood. The next we have useful in maintaining colloidal osmotic pressure. Okay, so this is very useful in maintaining colloidal osmotic pressure because of the presence of the plasma protein, that is albumin. It is very important, and also we're going to discuss this topic in detail. Okay, then next we have that it is useful in maintaining the viscosity of blood. Okay, so as we know, 80% of total plasma protein concentration is due to albumin, globulin, and fibrinogen. These three are very important, and they are present in traces. So blood viscosity is maintained at low level, and normally the viscosity is about 4 to 5 times of blood water. So due to the presence of these three proteins, globulin, albumin, and fibrinogen, the viscosity of blood remain maintained. Then next we have that it also provide stability to blood. Okay, so due to the presence of globulin and fibrinogen, if blood loses its stability, right? So it leads to Rowlac formation of RBC, and all the RBC compile over another. So that's how the stability of blood remain maintained. Then next we have, it is very useful in maintaining acid-base balance. So as we know that plasma proteins are amphoteric in nature. Depending upon the circumstances, it can act as acid as well as base. So that's how they are important for maintaining acid-base balance inside the body, because plasma protein act as a buffer, and their buffering capacity is about 1/6 of the total buffering capacity of the blood. And since they are amphoteric in nature, so they behave as acid or base depending upon the condition, right? Next, we have immune function. So as we have discussed that a form of globulin we have, that is gamma globulin, which is known as the immunoglobulin, that is responsible for providing immunity to the body. Then last we have that it transport and also reservoir function. So plasma protein form loses bonds with the hormone, drugs, metals to serve as a reservoir from which the same are released slowly at appropriate rate. So these all are the major function of the plasma protein. I hope all the student got this functions. Now next we have, so with the help of the machine, that is centrifugation, we can separate the different components of blood, right? So as we can see in the upper coat, we have plasma, which is around 55% of the total blood. And here we have RBC. And in this buffy coat, we have WBC and platelets. So with the help of centrifugation, we can separate all the components. And also for the separation of plasma protein, we have other method also for the separation of plasma protein. We have other method like precipitation method, in which proteins in the serum are separated into albumin and globulin, and this is done by precipitating globulin with 22% of sodium sulfate solution, and albumin remain in the solution. Then next we have salting out method. So again, serum globulin is separated into two fraction called globulin and pseudoglobulin by salting out with different solutions, and eoglobulin is salted out by full saturation with sodium chloride solution and half saturation with magnesium sulfate solution, right? Third, we have electrophoretic method. In this method also, plasma protein are separated depending upon their differences in electrical charge and the rate of migration, and it is done in a tissueless aperture by using paper or cellulose. Then another method is ultra centrifugation method. In this method also, albumin, globulin, and fibrinogen is separated upon the density, right? And this method is also useful in determining the molecular weight of these proteins, okay? Then last we have immunoelectrophoretic method. Okay, now what happened in this method? The proteins are separated on the basis of electrophoretic pattern formed by precipitation at the site of antigen-antibody reaction. This technique provides valuable quantitative measurement of different proteins. Okay, so this is all about the methods which are used for the separation of plasma protein. Okay, so as we know, the normal components of blood, in which we have whole blood 8%, and other fluid and tissue 92%. The blood plasma is 55, and form elements are 45%. So in proteins, as we are discussing, we have major protein, we have albumin, globulin, fibrinogen, and other 1%. Now, so as we know, plasma protein are more than 300 different protein, and many pathological conditions affect the level of these plasma proteins. They are mostly synthesized in liver, and some are produced in other sites also, like some are produced by plasma cells also. Okay, so we have a question here that the amount of plasma protein is near to, and as I have already told you the value, so I think now all the student will be able to answer, and for this I'm giving you 10 seconds. Yes, the answer is 7 gram, because the amount of plasma protein is 7 gram per 100 blood, right? So now we have the Starling forces, and as we have discussed that albumin is responsible for maintaining colloidal osmotic pressure. So now we're going to learn that how this protein is able to maintain that pressure. Okay. So as we can see in the diagram also, here we have 4 forces, and collectively they are known as Starling forces. So here we have PI, PC, pi I, and pi C. Okay, so PC refers to in capillary hydrostatic pressure. Remember, hydrostatic pressure means the pressure exerted by water, okay, fluid, right? Then in PI is interstitial hydrostatic pressure, means the pressure exerted by the interstitial fluid which is present outside the capillary. So here we have venous end, arterial end, and this is the capillary we have, and in the surrounding we have interstitial fluid, okay. Then pi C here refers to the capillary oncotic pressure. Always remember oncotic pressure. On the word oncotic means plasma protein, right? Then pi I refers to interstitial pressure, interstitial oncotic pressure, which is exerted by the different protein which are present inside the interstitial fluid. Then here we have the filtration coefficient, and we have reflection coefficient also. So here we're going to learn that what is going on, that we have the venous end here and the arterial end here, okay, and here we have the capillary. So as we have discussed, the first pressure we have the hydrostatic pressure that is exerted by capillary, right? So this pressure always promote filtration. So it will always tend to move the fluid outside the capillary, okay, because it is promoting filtration, okay. Then next we have PI, and here we have pi C and pi. Okay, so as we have discussed, this PC, that it always promote filtration. Okay, so this is a favoring force of the GFR also. Okay, then next we have pi C. So here this pi C means the pressure which is exerted by plasma protein which is present inside this capillary will try to absorb more and more amount of water inside from the interstitial fluid. Okay, so it will try to collect all the fluid which is present in the interstitium here. Then we have PI, means the hydrostatic pressure which is exerted by interstitium. So here it will try to move inside the capillary. Here this force is responsible for moving all the fluid which is present in inside the interstitium into the capillary. Then here we have the last one, pi I, means the force exerted by the plasma protein or the solutes which is present inside the interstitium. So this force also try to move inside the capillary. Means due to this force, all the fluid will try to move inside the capillary. Okay. So collectively, due to these forces, it always determine that what will happen, means whether the filtration will occur or not occur. Okay, so this is the formula we are having to determine the net fluid movement between two compartments inside the capillary. And whenever any of these forces get increased or decreased, so it is clearly indicating the presence of the pathological condition inside the body. So as we have discussed that these are the major function of the plasma protein. So one, we have discussed about the colloidal osmotic pressure, then viscosity we have done, then buffering action we have done, clotting and fibrolysis we have done, defense and function body we have done, transport mechanism we have done, then transport proteolytic enzyme system we know, plasma protease inhibitor system we know, and reserve source we know. Okay, so these are the major function of the plasma protein. Okay, so blood is viscous and its viscosity is 4 to 5 times of water. Viscosity of blood is contributed equally by blood cells and plasma proteins. Among protein class, we have the fibrous protein, that fibrinogen, major contributor of the viscosity. Blood viscosity is important to maintain diastolic blood pressure and is contribute to resistance to blood flow. And also there is one more, not this, wait. We have angiotensin. Angiotensinogen, which is a form of globulin, which is responsible for blood pressure regulation. Okay. Again, this is the form of globulin. Please remember. Angiotensinogen. Then measurement of plasma protein, quantitative measurement of a specific protein in which there will be chemical or immunological reaction, and for semi-quantitative measurement by electrophoresis, in which proteins are separated by their electrical charge in the electrophoresis, and 5 separate bands of protein like this will be observed. Okay, and these bands change in if any kind of disease is present inside the body. Okay, now we have the types of protein. So as we have discussed, for globulin, we have these several types, and for first we have pre-albumin, then albumin. For globulin, we have these several types, in which alpha-1 we have alpha antitrypsin, alpha fetoprotein, and alpha-2 globulin, ceruloplasmin, haptoglobulin, beta globulin, CRP, then transferrin, beta-2 microglobulin, and gamma globulin we have. So first we have pre-albumin that we're going to discuss, that is also known as transthyretin. So this is the type of protein for thyroid hormone and for retinol also, which is a vitamin form of vitamin A, which migrates faster than albumin in electrophoresis, and it is separated by immunoelectrophoresis, and its level found lower whenever any kind of disease like liver disease, nephrotic syndrome, acute phase inflammatory response, and malnutrition present inside the body, and its short lifespan is about 2 days. Then next we have albumin. So as we have discussed, this is the most abundant protein present inside the body, and again it is synthesized by the liver as pre-albumin and secreted as albumin. Again, its lifespan is 20 days. It decreases rapidly in injury and injection and surgery. Then the function of albumin, that it maintains osmotic oncotic pressure, the osmotic pressure exerted by plasma protein that pull water into the circulatory system. It maintains fluid distribution in and outside, and plasma volume that just we have seen, and 80% of plasma oncotic pressure is maintained by albumin. Then we know that normal fluid exchange occur here, like hydrostatic pressure at this end, arterial end is 35 mmHg, and at venular end it is 15 mmHg. And just now we have discussed that which forces are for the favor of filtration and which are not promoting filtration. Then pressure promoting filtration at arterial end, it is net filtration about 10 mmHg, and at venous end it is 9 mmHg. Now the function. A non-specific carrier of hormone, calcium, free acids, free fatty acids and drugs, tissue cell take up albumin by pinocytosis, okay, where it is hydrolyzed to amino acids. And also the albumin is very useful in the treatment of several diseases like liver disease, hemorrhage, shock, and in case of burns. Now, hypoalbuminemia. So hypoalbuminemia refers to decrease in the level of albumin in blood. Okay. And usually this condition occur whenever there is more and more appearance of albumin inside the urine. Okay, so decreased albumin synthesis in liver, it is another cause, and it increases losses of albumin in case of increased catabolism, in case of infection, excessive excretion by kidney in case of nephrotic syndrome, where there will be appearance of albumin inside the urine, then excess loss in bowel disease, then in case of severe burns, where plasma loss in the absence of skin barrier. Then hypoalbuminemia affects, what will be the effects of this hypoalbuminemia? So edema will be there, accumulation of fluid will be there due to low oncotic pressure. Albumin level drop in liver disease causing low oncotic pressure. So ultimately, if the oncotic pressure will get lower, ultimately it's lead to the condition of edema. Fluid movement into the interstitial spaces causing edema, because as we have discussed, this force which is present here will try to collect all the fluid from the surrounding. If this force get lower, so ultimately there will be the movement of fluid will occur inside the interstitium, right? Then reduced transport of drug and other substances in the plasma, reduced protein bound calcium, that is total calcium level drops. Ionized calcium level may remain normal in this case. The next we have hypoalbuminemia, in which there will be increase in the level of albumin in blood. So no clinical condition are known that causes the liver to produce large amount of albumin. Only it occurred in the case of dehydration. Then we are discussing the different other form of globulin, in which first we have fetoprotein. So this is the synthesized in the developing embryo and in fetus by the parenchymal cells of the liver. The level of this fetoprotein decreases gradually during intrauterine life and reach adult level at birth. The function is yet unknown, but it may protect fetus from several immunological attacks by the mother, and no known physiological function is present in adults. Elevated maternal fetoprotein level are associated with neural tube defect and anencephaly. Decreased maternal fetoprotein level are associated with increased risk of Down syndrome, and it is a tumor marker for hepatoma and testicular cancer. Then another form of globulin we have ceruloplasmin. As we have discussed, this is synthesized in liver and contain more than 90% of serum copper, and oxidoreductase that inactivate ROS, causing tissue damage in acute phase response, and it is important for the iron absorption from the intestine. And in case of Wilson disease, due to level of this ceruloplasmin, the copper get accumulated inside various organs like liver and brain. Then another form we have hepatoglobulin, and again it gets synthesized inside the liver. And this hepatoglobulin binds to free hemoglobin to form complexes that are metabolized in RES. It limits iron losses by preventing hemoglobin loss from the kidney. So this is very important for the prevention of hemoglobin loss from the kidney, and the plasma level decreases during the process of hemolysis. Then next we have another type of globulin, that is transferrin. So this is a major iron transport protein in plasma and 30% saturated with iron. This is very, very important for the transport of iron. Now, whenever the plasma level drops in case of malnutrition, liver disease, inflammation, malignancy, iron deficiency result in increased hepatic synthesis and a negative acute phase protein. Now, next we have beta-2 microglobulin, which is a component of human leukocyte antigen, which is present on the surface of lymphocytes and most nucleated cells, filtered by renal glomeruli due to its small size, but most 99% is reabsorbed. Elevated serum level are found in the case of impaired kidney function and due to overproduction and disease. Maybe a tumor marker for leukemia, lymphoma, and multiple myeloma. Then another we have CRP, that is C-reactive protein, which is an acute phase protein, again gets synthesized inside liver, and this is very important for the defense mechanism also, like it performs phagocytosis. High plasma level are found in many inflammatory conditions such as rheumatoid arthritis, and this is a marker for ischemic heart disease, where heart muscles get less supply of the blood. Then next we have hypergammaglobulinemia, may results from the stimulation of beta cells and monoclonal proliferation. Monoclonal hypergammaglobulinemia, where stimulation of many clones of beta cell produce a wide range of antibodies, and here gamma globulin band appear large in the electrophoresis, right? So this here in electrophoresis, its band appear very large. So clinical condition like acute and chronic infection, autoimmune disease, and chronic liver disease. And then next we have monoclonal hypergammaglobulinemia. So here proliferation of a single beta clone produces a single type of IG, appear as a separate dense band, and paraprotein are characteristics of malignant beta cell proliferation. And here the clinical condition is multiple myeloma. Next, we have positive acute phase protein. Plasma protein level increase in the case of infection, inflammation, malignancy, trauma, surgery. These proteins are collectively known as acute phase reactant. They are synthesized due to body's response to injury. An example we have alpha-1 antitrypsin, haptoglobulin, ceruloplasmin, fibrinogen, and C-reactive. Then these are the mediator cause these protein to increase after injury. And in mediators, we have cytokines, IL-1 and IL-6, tumor necrosis factor alpha and beta, interferons, platelet activating factor. Functions are to bind to polysaccharides in bacterial wall, activate complement system, stimulate phagocytosis. So next we have the technique. This technique is very, very useful for removing blood plasma from the body by withdrawing blood separately into plasma and cells and transfusing the cells back into the bloodstream. So basically this technique is useful for the purification of plasma protein, or for the for the separation of plasma protein. Clinical use, it is useful. It is performed specially to remove antibody in treatment of the autoimmune disease. So in autoimmune disease, like we have myasthenia gravis, and several other disease also there, like Good-Pescher syndrome. So in myasthenia gravis, this is an autoimmune disease which causes muscle weakness, and Good-Pescher syndrome. This is also autoimmune disease in which antibody damage basement membrane in lungs and kidney, resulting in bleeding in these organs. Next, we have negative acute phase protein. So these protein decrease in inflammation, albumin, pre-albumin, and transferrin, mediated by inflammatory response through cytokines and hormone. Synthesis of these protein decrease to save amino acids for positive acute phase proteins. Okay, so in summary, we have for transport, we have albumin, pre-albumin, globulin. For maintaining of plasma oncotic pressure, the albumin is very, very important. And for defense mechanism, we have gamma globulin and complement. And for clotting and fibrinolysis, we have prothrombin and plasmin. Okay, so this is all about the plasma protein. So last we have the MCQ. The plasma gamma globulin are synthesized mainly in, and I know that all the students knows the answer. Again, I'm giving you 10 seconds to answer this question. Yes, the answer is liver. We have a clinical case scenario also. So in the beginning of the class, I have asked you the question, and I guess all the student knows the answer. Then this condition of edema occur whenever there is decrease in the oncotic pressure and there will be accumulation of fluid outside the capillary. So answer will be A, decrease oncotic pressure leading to fluid extravasation into tissues. So this is all about the today's class. I hope all the students found this class very useful. Thank you so much.